Hi everyone, welcome to our channel, Canadian Nurse Expert. Let's dive into today's topic, deep vein thrombosis or DVT. It is a serious medical condition that occurs when a blood clot, known as a thrombus, forms in a deep vein. These veins are typically located in the legs, thighs, or pelvis. While seemingly straightforward, DVT can have significant and life-threatening implications if left untreated. Picture this. You're working a long shift on the ward. Your patient, Mr. Jones, is recovering well from a recent knee replacement. You notice a slight swelling in his calf, but he dismisses it as post-operative discomfort. This seemingly minor detail, however, could be a red flag for DVT. As healthcare professionals, it's our duty to be vigilant about DVT. We need to recognize the subtle signs, understand the underlying mechanisms, and be prepared to act promptly to ensure the best possible outcomes for our patients. The true danger of DVT lies in its potential complications. The most serious of these is a pulmonary embolism, or PE. A PE occurs when a part of the DVT clot breaks off and travels through the bloodstream to the lungs. This mobile clot, now an embolus, can lodge in a pulmonary artery, obstructing blood flow to the lungs. This blockage can be partial or complete, leading to a range of consequences from shortness of breath and chest pain to heart failure and even death. Beyond PE, DVT can also lead to other complications within the affected limb. Post-Thrombotic syndrome, or PTS, is a common long-term complication characterized by chronic pain, swelling, and ulcers in the affected leg. This can significantly impact a patient's mobility and quality of life. Understanding the underlying causes of DVT is crucial for effective prevention and management. Rudolf Virchow, a 19th century German physician, identified three primary factors that contribute to clot formation, now known as Virchow's Triad. First, hypercoagulability. This refers to an increased tendency for the blood to clot. It can be caused by inherited blood clotting disorders, pregnancy, certain medications like oral contraceptives or hormone replacement therapy, and some cancers. Second, venous stasis. This occurs when blood flow in the veins slows down or becomes stagnant. Prolonged immobility, such as during a long flight or bed rest, can contribute to venous stasis. Third, endothelial damage. The inner lining of the veins, known as the endothelium, can be damaged by surgery, trauma, or certain medical conditions like diabetes or high blood pressure. This damage can trigger the clotting cascade. These three factors often work in conjunction. For instance, a patient recovering from surgery may experience all three: endothelial damage from the procedure, venous stasis due to immobility, and potentially hypercoagulability due to the body's natural healing response. Early recognition of DVT is crucial for prompt treatment and preventing complications. However, DVT can be a silent threat, with many patients experiencing no symptoms at all. When symptoms do occur, they often affect the leg and include swelling. This is usually in one leg and can be in the calf, ankle, or foot. Pain. The pain can feel like cramping or a dull ache. It may worsen with standing or walking. Warmth. The affected area may feel warmer to the touch than the surrounding skin. Redness. The skin over the affected area may appear red or discolored. It's important to remember that these symptoms can also be caused by other conditions. However, any patient presenting with these symptoms, particularly those with risk factors for DVT, should be evaluated for possible DVT. Diagnosis. Unveiling the clot. Diagnosing DVT involves a combination of patient history, physical examination, and diagnostic tests. We ask questions about their medical history, family history, and recent immobility or surgery. Physical examination focuses on comparing both legs for differences in size, temperature, and tenderness. However, physical examination alone cannot confirm or rule out DVT. Non-invasive imaging tests are the mainstay of DVT diagnosis. These include duplex ultrasonography. This is the most commonly used test. It uses sound waves to create images of blood flow in the veins, detecting any blockages caused by clots. D-dimer blood test. This test measures D-dimer, a protein fragment released into the blood when a blood clot breaks down. While a positive D-dimer test doesn't necessarily confirm DVT, it can be helpful in ruling out the condition in low-risk patients. In some cases, further investigations like venography, a type of X-ray using contrast dye, might be necessary. Treatment strategies for combating DVT focus on preventing the clot from growing larger, stopping it from breaking off and causing a pulmonary embolism, and reducing the risk of long-term complications like post-thrombotic syndrome. Treatment typically involves several approaches. Anticoagulants, often referred to as blood thinners, help prevent blood clots from growing and reduce the risk of new clots forming. These medications are available in oral and injectable forms, and the choice depends on the patient's individual needs and risk factors. Common examples include warfarin, heparin, and newer direct-acting oral anticoagulants like rivaroxaban and apixaban. In some cases, particularly when the clot is large or causing severe symptoms, thrombolytic medications, also known as clot busters, may be used to dissolve the clot. These are usually administered intravenously. An inferior vena cava filter is a small, cage-like device inserted into the inferior vena cava, the large vein that carries blood from the lower body to the heart. The filter traps large blood clots that break off from the legs, preventing them from reaching the lungs and causing a pulmonary embolism. IVC filters are usually reserved for patients who cannot take anticoagulants or those who have recurrent PEs despite anticoagulation. Compression stockings are specially designed to help improve blood flow in the legs and reduce swelling. They are often recommended for patients after DVT treatment to prevent post-thrombotic syndrome. Treatment plans are always individualized based on the patient's specific needs and the severity of their condition. Prevention is the best defense against DVT. As healthcare professionals, we play a vital role in educating patients about DVT risk factors and implementing preventative measures. These can be categorized into several settings. In a hospital setting, encourage patients to start walking as soon as possible after surgery or illness. Pneumatic compression devices, also known as sequential compression devices, inflate and deflate periodically, mimicking the natural pumping action of leg muscles and improving blood flow. For patients at high risk of DVT, such as those undergoing major surgery, prophylactic anticoagulation with low doses of blood thinners may be prescribed. At home, encourage patients to stay active and engage in regular physical activity. Even simple exercises like ankle pumps and foot circles can help improve blood flow while seated. Maintaining a healthy weight can reduce the risk of DVT, and staying well hydrated, especially during long journeys, is also important. During travel, advise patients to avoid sitting for prolonged periods, especially during long flights or car rides. Encourage them to get up and walk around every hour or so. Compression stockings can be particularly beneficial during long journeys. By incorporating these preventive measures and educating patients about DVT, we can significantly reduce the incidence of this potentially life-threatening condition. Certain patient groups require special attention regarding DVT prevention and management. Pregnancy increases the risk of DVT due to hormonal changes and increased pressure on the veins in the pelvis and legs. Cancer and its treatments can also increase the risk of DVT. Age is a significant risk factor for DVT, particularly for elderly patients with limited mobility or other underlying health conditions. These patients may require more frequent monitoring, individualized preventive measures, and tailored treatment strategies. DVT is a serious condition, but with vigilance and the right knowledge, we can make a real difference in the lives of our patients. Here are some key takeaways for healthcare professionals. Maintain a high index of suspicion. Always consider DVT as a possibility in patients presenting with leg pain, swelling, or other suggestive symptoms, particularly those with risk factors. Educate patients. Discuss DVT risk factors and prevention strategies with all patients, especially those at increased risk. Implement preventive measures. Implement appropriate DVT prophylaxis measures in hospital settings, including early ambulation, pneumatic compression devices, and prophylactic anticoagulation when indicated. Ensure timely diagnosis and treatment. If DVT is suspected, promptly initiate appropriate diagnostic tests and, if confirmed, initiate treatment without delay. By staying informed about the latest guidelines and best practices, we can provide the highest quality care for our patients and help prevent the potentially devastating consequences of DVT. Be curious and keep learning. Thank you for watching. See you later with another interesting topic.